And
Well, in case anybody didn't hear that, this program is being recorded. And thanks everyone for joining this morning. I'm Jennifer Epperly, and I'm a board member with The Caring Place, and I'm heading up this Alzheimer's Education Initiative. So this is the first of our series that we're going to be doing on Alzheimer's and dementia. So thanks for being here, and we're very appreciative of the Alzheimer's Association connecting us with Dawn Langford, who's here with us this morning. She's a community educator with the Alzheimer's Association, and she's going to be presenting this program on understanding Alzheimer's and dementia. And Dawn, is there anything else you'd like to say to introduce yourself? And then I'll turn it over to you.
Oh, no, not really.
Okay.
I am a community educator at the Greater Kentucky and Southern Indiana chapter of the Alzheimer's Association. I am a senior practicum student at the University of Louisville, and I will be graduating in May. I will be starting the master's program in May as well. So that's a little bit about me. This is a shortened version of this program. So welcome. This education program is presented by the Alzheimer's Association. It's designed for those who are interested in learning more about Alzheimer's and other dementias. It features information from dementia experts and perspective from individuals living with dementia and care partners. Throughout this program, there's going to be opportunity for interaction. You guys can put the answers that you have in the chat box, or if you just want to speak up when I ask questions, that would be fine as well. I will be asking questions throughout, and if you have any questions throughout, you feel free to ask. And if you want to ask at the end, you will have an opportunity to do that as well. This program should take about 30 minutes or so. So let's take a look at what we're going to discuss today. Please let me know if you have any questions or issues hearing me as I advance throughout the program. So today we're going to take a top level look at Alzheimer's and dementia and give you a broad understanding. By the end of today's program, the goal is for you to be able to compare Alzheimer's and dementia, recognize how Alzheimer's disease affects the brain, list the risk factors of Alzheimer's disease, identify the 3 stages of the disease, recognize current FDA-approved treatments that can address some symptoms of the disease, describe how scientists are working to advance research, and name the resources available through the Alzheimer's Association. And I'm just going to have to skip through these a little bit. So you may hear the terms Alzheimer's and dementia used interchangeably. They're related, but they are different. In this section, we're going to discuss both Alzheimer's and dementia, how they are related. And before we begin, let's take a moment to test your knowledge about Alzheimer's disease. This is your opportunity to put your answers in the chat or speak up. So, do you think Alzheimer's is a normal part of the aging process? How many of you think it is false?
false.
False.
You can just false. Okay, we have one false. Let me check the chat. Jennifer says it's false. Daniel says it's false. Ray and Ann say it's false. Patricia says it's false.
False.
Okay, Sue says it's false. Let's see. This is false. Alzheimer's disease is more than memory loss. It's a progressive and fatal disease that kills nerve cells and tissues in the brain, affecting an individual's ability to remember, think, plan, and ultimately function. Let's try another one. You guys did really well. True or false? People younger than 65 can develop Alzheimer's disease. How many of you think it's true?
True.
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 Daniel says it's true. Jennifer says it's true. Patricia, true. Roxanne, true. Does
True.
anyone think it's false? No? Nobody? Let's see. This is true. Approximately 200,000 Americans younger than the age of 65 are living with younger onset Alzheimer's. It's also known as early onset. In some cases, people develop the disease in their 40s and 50s. This is part of the population I was discussing before the program started. Now let's watch a video with one of our experts, Dr. Heather Snyder, explaining how Alzheimer's and dementia are related. Let's hear from her.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
As we saw, there are many causes of dementia other than Alzheimer's. However, about 60 to 80% of all dementia cases are caused by Alzheimer's disease. There are numerous types of dementia, and each type has different cause and symptoms. These are just a few classifications. As we discussed, Alzheimer's is a brain disease. The brain is our most important complex organ. It's also our most powerful, despite weighing only about 3 pounds. So let's hear from another expert about how Alzheimer's affects the brain.
More than 100 years ago, Dr. Alice Alzheimer's described specifics and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has 3 main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
With the brain is at risk for developing Alzheimer's disease. There are a few known factors that increase a person's risk of developing Alzheimer's disease. So let's see if you know which one is the most common. You guys didn't think you were going to have to work today, but I have another question. So which one of these options do you think is the greatest risk for Alzheimer's disease? Is it genetic, family history, or age? Who thinks it's genetic?
Think it's
What
genetic.
about, you think it's genetics?
Yeah.
What about family history?
I want to go family history.
Family history.
Family history. Okay, 2 family histories, 1 genetics. What about age? Nobody? Let's check genetics.
Let's go.
Not genetics,
Aww.
not a
Oh.
family history. Oh my
Wow.
goodness, y'all.
Wow.
Age.
Oh, fail.
As mentioned,
Age was
I
just
know, as mentioned, these are all known risk factors. However, age is the greatest known risk factor. Now let's hear a little from one of our experts as she explains the most common risk factor.
Let me interrupt. Am I the only one that cannot hear the people talking?
Can you hear me talking?
I can hear you, but I can't hear when you place somebody.
When
I can hear them, but it's a
I
little
can.
bit garbled.
When someone else is speaking?
Yes,
Right.
when it's on the screen, not you.
Okay.
And I can't
could-
see it on the screen either.
Can you all see the videos on the screen that I play?
I
Yeah.
can.
Okay. The garble could be my internet connection. So I apologize for that. Or it could be the recipient's internet connection. I'm not really sure. Let's try this one and see if you can hear this one.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's, and when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
Although Alzheimer's is not a normal part of aging, age is the greatest known risk factor. Let's take a look at some populations who are at higher risk for developing the disease. In addition to the main risk factors for the general population, Hispanics, African Americans, and women are at higher risk for Alzheimer's. Research shows that older Hispanics are about 1.5 times as likely as older whites to develop Alzheimer's and other dementias, while older African Americans are about twice as likely to develop the disease as older whites. The reason for these differences is not well understood, but researchers believe that higher rates of vascular disease in these groups may also put them at greater risk for developing Alzheimer's. Women are more likely than men to develop the disease. An estimated 3.4 million American women are living with the disease today. We know that women live longer than men, making them more likely to develop Alzheimer's. However, longevity and lower death rates can only partially explain this difference. Researchers are exploring how genetic differences between men and women may impact disease risk.
You know, can we interrupt for a second, or?
Certainly.
Okay, I went to something by Sanders Brown about before COVID, when they were doing things in person, so fairly long time ago now. And
Yes.
they were saying that the guy was saying that a main researcher in the Sanders Brown thing, that people, if you have not developed Alzheimer's by 75, but yet you're experiencing these dementias, more than likely it's due to one of these other causes. You know, so Alzheimer's isn't, if you don't get it by a certain age, you're not going to get it. You're going to get one of the vascular. And he said, usually it's Lewy bodies or vascular, you know.
Really?
Yeah.
That's information I did not know.
Yeah, so I thought that was really interesting. And I thought it was just great because I'm 75. That means that maybe I'm safe.
Do you think you're safe? Well, I hope that that information relayed to you was correct. I do. That would be great.
But
the
that's
gold-
interesting though, isn't it?
that's
I
the
thought that was
goalpost.
really interesting.
That is, again, that's information that I have not heard. So that is good information to know. So no two individuals experience the symptoms and progression of Alzheimer's disease the same way. Let's hear from another expert, Dr. James Hendricks, on why this is the case, as well as from some individuals describing what it is like to live in the early stage of Alzheimer's disease.
One of the things that impacts our brain is all the other things that can happen to us as we age. And we know that Alzheimer's, the most common risk factor for getting Alzheimer's disease is age. But we also have lots of other things that go wrong with us as we age. And so how those other health factors impact our brain can also impact how Alzheimer's presents in other people.
So what does living with Alzheimer's disease feel like? We're only going to watch 2 of the videos for people living with Alzheimer's.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before in order for you to continue to read on. And so I can't read a novel, so I've even stopped trying.
I think the thing that surprises me the most about my dementia is that it is progressive, and I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor's, and so that becomes a little disconcerting at times, to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
Again, the individuals we just heard from are living with the early stage of the disease. Symptoms worsen over time for everyone. However, people progress through stages of Alzheimer's at a different rate as their abilities change. On average, a person with Alzheimer's lives 4 to 8 years after diagnosis, but can live as long as 20 years, depending upon other factors. Now let's hear from Dr. Snyder explain the 3 general stages of Alzheimer's disease.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is, their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
This next module by seeing what you already know about the treatments available for Alzheimer's disease. This is another true or false question. True or false? Current drugs help address symptoms, but do not treat the underlying cause of the disease.
True.
True. True.
Got 3 truths.
Yes.
Check
True.
the chat. 2 more truths, 4 more truths. Let's see. It's true. While these medications do not stop the damage Alzheimer's causes to brain cells, they may help lessen or stabilize the symptoms for a limited time. There are several drugs available to slow down the progression of Alzheimer's disease. Let's hear from an expert.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time. So the first class of drugs are cholinesterase inhibitors. These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razidine. There's another class of drugs that modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
Because everyone experiences Alzheimer's differently, these treatments work in varying degrees and are not effective for everyone. An accurate diagnosis is important to ensure that the proper treatment is prescribed. Drug misuse may lead to negative side effects. In the last decade, researchers have made enormous strides in understanding how Alzheimer's disease affects the brain. Many recent insights point toward promising new strategies for treatment.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease is a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
I'm excited about what we're learning these days regarding lifestyle. One of those things that we've seen in the past of things like exercise and nutrition have now started to gain more momentum to indicate to us that it can change your ability to slow cognitive decline. That is really the first stages of Alzheimer's disease. This may include things like social engagement, mental cognitive training. It can be things such as exercise. It can be nutrition. All those things are now starting to point that they will lower your risk for Alzheimer's disease.
As we just heard, there's a lot of hope for where we're headed with Alzheimer's research. One of the key ways to keep research moving in the right direction is through clinical studies. Let's take a look at an association service that can help people find studies.
Currently, more than 5 million Americans are living with Alzheimer's. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
The Alzheimer's Association is across the country providing direct service to individuals and families facing the disease. Let's check out a few of the resources available. The association is available wherever and whenever you need reliable information and support. 3 of our key resources that can connect you to information and support include our 24/7 helpline. Call us at 1-800-272-3900 anytime, day or night, to receive information and support. We provide access to highly trained and knowledgeable staff who can help with education, decision-making support, crisis assistance, and resource identification. Master's level clinicians are available around the clock to provide an in-depth care consultation, a free of charge care navigation service offered to families at any stage of the disease, and help is available in more than 200 languages. Oh, let's go back. Sorry. I'm looking for my ALZ page. Okay. Me out here. Anyway, so then we have the 24/7 helpline. You can find resources and communities nationwide at alz.org/CRF. That is our community resource finder that helps you locate resources within your community. And I apologize that my internet connection is unstable. I just got that little message. Are there any questions while I'm looking for this slide with the resources? Over anything I just covered or anything pertaining to Alzheimer's
There are
or
currently
dementia?
So you said, is there an increase in diagnosis, or is it just we're more aware? Because let's say back in the 50s and 60s compared to now, there seems to be a big increase.
There's an increase in diagnoses.
But did people already have it and they just assume it was just the normal aging process and then really think it was Alzheimer's?
It was assumed that it was a normal aging process to some degree, but the diagnosis rate has gone up dramatically. So there's a causation correlation factor there, just as with all other diseases that have increased over the years. They're trying to figure out why. I found the slide. That's our helpline, 24/7, 800-272-3900. ALZ.org is, you can find all programming as well as information for resources available there. And the community resource finder is alz.org/CRF. Anyone else have any questions?
Yeah, I had a question about, so when you were talking about the mild, moderate, and severe stages of Alzheimer's, so it said somewhere at the bottom that a healthcare professional would like perform a test to find if they're at the mild stage. Do you know like what type of questions they would ask?
It's a cognitive test, and that's performed by neuropsych or neurology or even general practitioners. That can also be determined by different imaging, depending upon what they think, what Alzheimer's, what dementia the person may have. But there's a series of cognitive tests that are done based upon clinician, either specialty and or observation. So depending upon, what symptoms the person is showing, that depends on what kind of cognitive tests they are given. But again, that's neurology, neuropsych, and some general practitioners will do that as well.
Hey, Deep, I know a lot of the specific questions if you're interested.
Sure.
First of all, it would be your name, the date, where you are right now, and who is the president. And then it goes into several memory tests, which could be remembering names, remembering the names of objects, remembering the examiner would tell the person a story and ask the patient to tell the story back. There's like numbers forward and numbers backwards, like 874. You do the numbers forward, and then the next part of the test would be 478. There's a drawing part where they show you a figure, and for like 30 seconds or something, or two figures, and then they take it away and ask you to draw the figure. There's some simple math questions, and there's some more reasoning type questions, like if your bathtub was overflowing, who would you call? That kind of thing. And there's more, but those are the ones that come to the top of my head at the right away.
Okay.
Pretty well covered it, I think, because I've had those tests. Now when I go in for my physical, I have to take those cognitive tests, and you covered it, nearly all of it.
Yeah, so when you're going in for one of those tests, the first thing you need to do is check what the date is.
That's right. I've gotten smarter.
I would
Sure
definitely
I know that.
Don, I have a question. How do doctors diagnose whether it's Alzheimer's or it's dementia? What test?
It's the cognitive testing, and it's based on, again, observation to determine whether it fits in the Alzheimer's category or another form of dementia category. We covered a little bit about, I didn't cover all the videos because this was a shortened program, but there are many different forms of dementia. Dementia is the umbrella term. So based upon, again, the symptoms and observation, they would determine what test is necessary to determine what type of dementia it is, or if it is Alzheimer's disease. But a lot of them overlap, so it's difficult.
Dawn, I have another question for you.
Yes, ma'am.
Two of the symptoms that I recall from my father having Alzheimer's that I am not sure that is connected to other types of dementia is that the shadowing one and the constant repetition of the questions.
Mm-hmm.
Is that specific to Alzheimer's, or do some of the other dementias have those?
Both. It's
Both.
completely overlapping. My father has mixed dementia. He has vascular and Alzheimer's. Both of those things that you just described are a factor in both of those.
Thank you.
Mm-hmm.
I have another question.
Yes.
Don, is it also true that Alzheimer's cannot definitely be diagnosed until a patient dies and the brain is examined?
That I don't think is. There are some dementias that cannot be, like CTE. The Alzheimer's can definitely be diagnosed upon death, but it can also, I'm pretty sure, be diagnosed in MRI imaging, the parts of the brain that aren't lighting up. But that would be something you'd have to ask your medical provider.
Okay.
Have you ever watched This Is Us?
I have not.
Okay, it's a wonderful TV series that actually is coming to an end. It's in its 6th or 7th sequence, I believe, season. And they have they're telling the story of the main matriarch, and she has Alzheimer's, right?
Mm-hmm.
She was diagnosed. She started off with the mild cognitive impairment, and then they did these repeated MRIs. To one day she came back to the family and she announced that they now have found plaques in her brain.
Mm-hmm.
And that to them was, so it started into the 2nd stage now. It's beyond the mild cognitive impairment. And I thought that they were doing just a wonderful job in informing and educating the public, who will never get a chance to come to one of these in-services, but through a wonderful TV series. And I thought it was pretty accurate as to what they were saying, with that.
There's a series on HBO I started watching it. It's a very hard watch. About in conjunction with, I believe it is in conjunction with the Alzheimer's Association, about Alzheimer's and other dementias. It follows several people throughout their journey from diagnosis up until unfortunately death, as well as their caregiving partners. So that could be of interest to some people. Again, it's on HBO Max, and I'm pretty sure it's on HBO as well.
What's it called?
Give me a second. I'll have someone look that up for me.
Oh, you can't remember. Do
No.
you have Alzheimer's?
Yeah. You know, I've not had one of those memory tests in a while, so I'm not quite sure. But there are some definite factors in the things that I deal with daily. The Alzheimer's Project is what it's called. Thank you. My partner over here was looking it up for me. The Alzheimer's Project.
Thank you.
And you said that's on which streaming service?
HBO and HBO Max.
Okay. The Alzheimer's Project. Okay.
Does
Any other questions?
does the
sorry.
Alzheimer's Association actually do research, or is it more of a?
Oh, yeah, no,
informative?
we are the second leading provider of research to the federal government in Alzheimer's disease and other dementias.
Right.
Another question I had was, do you know like of some other diseases, like for example diabetes, that would put you at a greater risk for?
There is a causation and correlation. They're studying that now, especially with minority populations, as we discussed in one of the modules, because of the vascular risk. Diabetes, obesity, heart disease, all of those they are thinking could be risk factors, increased risk factors, what they call comorbidities, in developing Alzheimer's and other dementias. So yes, they are studying that, and there are several research papers and studies on that already. So yes, they're pretty sure there's a causation there.
Okay.
Any other questions?
I think one of the interesting things that's coming out is with any type of sensory loss, how there's a risk factor. So increasing deafness, loss of vision. I would imagine even with COVID, when people now have long-standing smell and taste disorders, that also is going to affect and be a high risk factor for Alzheimer's.
Yes. Sensory deprivation and sensory issues are a cause. Hearing loss, again, my father has mixed dementia. Hearing loss is a huge factor in his. And before the program we talked about COVID isolation. Again, increasing diagnosis and death with Alzheimer's and other dementias. Isolation, sensory deprivation. That is correct.
I have a question about the Lewy bodies. That's under the dementia umbrella. Would Pick's disease fall under that? My late brother was diagnosed with Pick's disease before his death.
I do not know. I don't know that disease, but I can get that answer for you as soon as I'm done. I can look that up and get that information out to the organization today.
Thank you.
Is it PICS or is it PICKS?
You know, I am not sure. I think I always think PICKS, but I'm not sure about that. But he was diagnosed at Sanders Brown, so I was just curious if that fell under the Lewy bodies or.
You know, I'm sorry, I do not know. Was he diagnosed with imaging, MRI or CT or blood work?
You know, I'm not sure because I was not with him when that was all done, but I would have to ask his daughter. But anyway, thank you.
Yes, ma'am.
It is PICKS, And
Okay.
I imagine if he was at Sanders Brown, they went through a whole series of different tests. And not just one that was conclusive about that. And I think it is a little bit different than Lewy bodies, but I'm not sure about that. So if you could look anything up about that, Dawn, that would be very helpful, because I too would
Sure.
like to know.
Sure. I was just looking, the importance of accurate diagnosis has a list.
It was named after Arnold Pick.
Oh, is
Okay.
that right?
Mm-hmm.
Did he have it or
Yep.
discover it?
In 1892, and was originally called Pick's disease.
Thank you. Pick's disease, 1892. Let me see.
And it is a form of dementia.
Mm-hmm.
Oh, thank you.
I thought it was a more recent thing than 1892. I thought it was one that they had recently found. Okay.
It's just far less common than Alzheimer's.
Okay.
Then there's also the Korsakoff syndrome caused by chronic
That's related to alcoholism, yeah.
Mm-hmm.
Dementia is the
I'm looking for the descriptive. I think I passed it up. I did. 2 slides back of the listing of is it this one?
Dementia is the umbrella term for an individual's changes
I'm pretty
in
sure it's
memory,
after this
thinking, or
video.
reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain.
Oh, I passed it up again. I guess I have to watch the whole video. But the listing I have is CTE, which is chronic traumatic encephalopathy. I'm not going to try to pronounce the first part of that word. It starts with a C. Jacob disease, dementia with Lewy bodies, Down syndrome and Alzheimer's, front temporal lobe dementia, Huntington's disease, the Korsakoff syndrome, which is the alcohol syndrome someone just mentioned, mild cognitive impairment, which is not a form of dementia, mixed dementia, I talked about that, normal pressure hydrocephalopathy, Parkinson's disease, dementia, posterior corticodal dementia, posterior, I already said that, traumatic brain injury, which is not a form of dementia, but it can lead to that, and vascular dementia. So I will notate Pick's disease. So thank you all for that information. I can use that.
Yeah, thank you. You know, with the increasing amount that we're seeing of these neurological diseases, it makes you really think, and I've heard other people say this, you know, it must be something in the air or the foods we eat.
Mm-hmm. There is a nutrition and lifestyle component that they're working on researching. But again, I can't speak to that. We do have a course on healthy brain and body. I have I have participated in that, but I have not presented that. So that does talk about some facts and figures associated with nutrition, lifestyle, and brain health.
Mm-hmm.
Don, my husband and I work a lot with diabetes, and we heard a program where Alzheimer's there's research has been labeled diabetes type 3. You know, we have type 1 and type 2, and now there's research going on to label Alzheimer's as type 3 diabetes. So there's quite a link there between the two.
There is, and they also they designate it as that because it's so common, just like type 2 diabetes is so common. But yes, there is. They think there is causation That's kind of the diabetes type 3 is kind of the slang term for it. But yes, they are working on that causation link. And there was a recent study that I read about sugar consumption in young African Americans, teenagers, and they followed them throughout their teenage years up till their middle and late years. And the causation of sugar consumed throughout their young adult life and developing Alzheimer's and dementia. So there are definitely research studies out there. Anything else?
Well, what about the APO gene that they talk about? And its correlation?
What
The
gene?
APO gene?
Yeah.
The two gene risk factors, if you have both the genes, they say that you're guaranteed to get it. If you just have one gene, you are not guaranteed to get it. It's the expression of the gene. I am not well versed in the gene aspect of it, but most doctors will not do the genetic testing because, again, just because you have the one gene does not mean it's going to express itself. There's also a cost factor involved, and also it could be detrimental to future, a lot of future things like insurance, healthcare, life insurance, with the genetic testing involved, because you would already have predetermined that you could develop that. So there's a lot of questions with gene research right now. So, but I'm not well versed on that either. That's something that your medical provider would have to help you with.
But it would sure point to a genetic component to all of this. But I can see the ethical concerns with any gene testing.
Yeah, there. As I said, if there is a correlation with the genes, they are not sure that it's causation, but it is a risk factor. Not the greatest. Age was the greatest risk factor in developing Alzheimer's or dementia. So,
yeah.
So do you know if this gene is found in other animals, like mice, zebra? No.
I don't know. I'm sorry. Again,
Okay.
that's a question I don't have the answer to.
But interesting question, Deep. That would be interesting to really look into. I wonder.
Yeah.
You could probably call the helpline. They could probably answer that.
Yeah.
1-800-272-3900. They have the answers for almost everything.
Yeah. And ageism could be just because there's other things that are starting to develop with age, not that it's just that you're growing older. But that's when a lot of things, you've always had it. You've always had it. And then when you get to be in your 40s or 50s, it becomes a little bit more evident.
It could be gene.
Yeah, gene expression. That's most things. Your genes are expressing due to outside forces or lifestyle. So,
Are any studies being done with our food? With the use of GMOs, there's very little, like the wheat of the 40s and 50s is not the wheat of today. That sort of thing. So you can't really look at this, say, wheat in the same way as you did earlier. Is there any cause and effect on the way our food is being manufactured?
I do not have specific evidence to point to that, the causation and correlation of GMOs, processed foods, and the mutation of foods. The Alzheimer's research is researching lifestyle factors such as nutrition, but I myself cannot point to any specific study to give you to check that out. I'm sorry.
Well, let's hope it's not GMOs. Otherwise, we're all done for.
There's a way to circumvent GMOs and modified foods, processed foods. You just, whole foods, biologically appropriate foods, things like that. Anybody else? Well,
This
thank
was
you
very
all so
interesting.
very much.
Yeah, I want to thank you very much, Dawn, for coming on and presenting this program to us and kicking off this series. And for everyone who's on, we'll be having another in the series of Alzheimer's education the first Saturday of May, which is actually going to be Derby Saturday. So
Oh, wow.
you'll start your Derby Day right with some Alzheimer's education. So once again, thank you so much, Dawn, for
Certainly.
presenting today.
Thank you all so much. You have a great weekend. Best wishes to you all.
Thank you.
Thank you.
And
Thank you
Ashley,
very
I
much.
don't know if you want to wrap up.
Yeah, this has been very interesting, I think.
Yeah, this has been a great program.
Yeah, again, a reminder of the April 23 recognition banquet. We need your RSVP. And Roxanne, is there anything else?
Well, I just had one thing for actually Jennifer. I was going to give you all the names of and emails for the people that are in a caring place and WIMA that participate. I was thinking of that last night when I put out an email about this, that you'd probably be the person that would want to do that. And I kind of took it away because you didn't have the emails. So I'm going to send that to you.
Please do. When you send it out, I thought, I should have asked earlier to get that list because I needed to send something out. So thank you for doing it. And yeah, please send me the list so I can do it in the future.
Okay.
I think this is rather interesting that we can pick a certain subject to talk about, this and, the death cafe. Maybe we come up with more of these, maybe heart disease or something like that. Get an expert or somebody to talk about, a certain illness in the future.
I think that's a great idea.
We can do the second Saturday of each month towards cardiovascular disease.
Right. Or other diseases, right?
Yeah.
Well, the heart disease is, a lot of people die from that. And of course, then there's cancer, so.
Cancer.
Yeah. Yeah, there are a lot of different diseases that we could talk about occasionally. So.
My issue is osteoarthritis, and I don't think that you die of it. I just think you're miserable until you do die sometimes.
The thing with Alzheimer's is so many symptoms and diseases are correlated.
But don't you think that what we're doing, if a lot of times it's decrease in sensory input, which seems to be a given to me. I mean, we're going to see a rise in assisted living and nursing home because of the social isolation over the last 2 years. Don't you think that what we're doing with a caring place in WIMA, in having these socialization groups and the Tai Chi group and the Read On group and all of those are sensory input, right?
Oh yeah.
So we are taking a very forward progressive stance in actually mitigating some of these risk factors, correct?
Yes.
Yeah. So hooray for all of you. And once again, a huge thank you to all of you.
Amen.
Amen.
Okay, with that, it's just about time. And so we are faith-based. And with that, I think I'll lead us in prayer, if I may. And Holy Father, we thank you for allowing us to gather today to learn about Alzheimer's and dementia. And Father, we pray that a cure will soon be found for this dreadful disease. And also today, Father, we think of the sad things happening in Europe. And today we particularly pray for those that are forced out of their homes in Ukraine. And we pray that they'll soon find be able to cease that terrible war. So, and of course, we ask you that you bless everybody here today. Amen. All right.
Amen.
Amen.
All right.
Thank you, Don.
And
Thank
we'll,
you,
Thank you,
everybody.
Jennifer.
thank you very much, Jennifer. Yes.
Thank you,
Yes,
everyone.
thank you.
Thank you.
Thank you
It's
so
a
much.
great program. Okay, thank you, everybody. We'll see you. Goodbye.
Bye-bye.
Bye-bye.
And we don't have the meeting today, right? After this call?
We don't have the meeting. The meeting was at 9 o'clock, but nobody RSVP'd, and so I canceled it.
Oh,
And I don't know, Deep, that was going to be just to look at why my issues. If we have
Okay.
the Alzheimer's thing on the first Saturday, maybe we only need to meet once a month,
yeah.
so it's not like back to back,
Mhm.
for the Wyma kids. What do you think?
Okay. Yeah, that sounds good. Yeah, it makes everybody's life easier, right? And I mean, if we're progressing, so I started emailing people about, like, how you said you wanted desk at the student center, we could advertise, blah, blah, blah. I haven't gotten any responses, but I'm just going to keep copy and pasting and emailing until somebody does respond to me.
Right, right. And there's somebody I just talked to recently who's very good at knowing where to advertise, the best places to advertise. And I just talked to him yesterday. I talked to so many groups that I can't remember exactly which group it was, but I'll find out.
Okay.
And I'll let you know.
Yeah, can you just text me who that was if you find out?
I will.
Okay.
And in the
Okay.
meantime, is Joe still here?
I'm not sure. No, Joe's not here.
Okay, because we need the phone numbers for all of the Wyma, so when they don't respond through email, because maybe they're not using email,
Yeah.
they will respond through a text. So and then I thought he's probably, 'cause you told me he's going to be the president.
I think so, but
Well,
I'm not
if
sure.
he is, that would be a good job for him. I mean, that's part of leadership, is trying to get your demographics and your contact information and putting it all in one location and blah, 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 At least they told me that was my responsibility. So I would say that's Joe's responsibility. So I thought maybe
From
you
chairman to chairman, right?
Yeah, so I thought you might mention it to him that we really need phone numbers.
Okay. Cool. I'll mention that. I'll text him over Group Me, and then if he responds to me, then I think he'll get it done. He should respond.
Great, thanks.
Yeah, because I know him from tutoring. Actually, we tutor with the same company. Have you heard of The Study?
No.
You haven't? So The Study is like the tutoring thing through transformative learning at the University of Kentucky. And he tutors organic chemistry and I tutor general chemistry. So we're both like chemistry tutors, and I met him at training, and I was talking about how I had to do meal deliveries that past day, or it was that week or something. And he said, "Oh, you're in Wyma?" And I was like, "Yeah, have you heard of it?" And he goes, he said that he was going to be the upcoming president after Taylor. I was like, "Huh, okay, I guess."
Oh, well,
yeah,
he really probably it would be nice to get a formal announcement.
Yeah,
you might mention that to him too, because it's nice for us to know who's who.
Yeah. And I mean, I agree with what you said. I don't think there really should be any assigned roles in general, like that in depth, because then nobody wants to do anything. Like everybody's scared to step up, like if there is a specific role, oh, he's gonna do it, he's assigned to that role.
Right.
And then nobody else.
I don't like that either. I don't like that either. I think that, like you and Katomi, to me, are doing it all. You don't have silos built around you. However, the chairperson or the president or whatever you want to call them, I would say that their biggest job is getting the contact information together, and also starting to look at recruiting and retention. I think is their job. I mean, they can designate, they can delegate, etc. But mainly that's what they do. It's not that they micromanage the directors or micromanage what's going on.
Yeah,
But-
exactly. Yeah, we're not that big of an organization, right? So, I mean,
Right.
there is no micromanaging necessary, right?
Right.
So yeah, I'll get to texting him and I'll see what happens from there. I'll let
Okay.
you know.
Thanks, Deep.
Cool.
Hey, goodbye, guys.
Bye bye.
Bye, Don. Bye, Deep.